I do believe that this presentation is a gateway, a door opener, a foundation for everyone attending, anyone who's listening to this presentation. I believe that it's just the starting point. I believe as when we go through this presentation, you're going to see that there's a lot of opportunity for us to help patients in the clinic, and I see a bright future for all of us in helping that. So I hope that there's enough information. I think there's so much information, it might be overwhelming at times, but you can bring all this information back, you can digest it, bring it back to your clinic, and help your patients. And if you have any questions afterwards, don't hesitate to reach out and get a hold of us. So I hope you enjoy our presentation, and I'm going to hand it off to Julie.
Well, thank you, Brian. That was a very lovely introduction. You know, there's very few people in your life that you can get a cup of coffee with and talk about Chinese medicine for an hour and a half, right? If all of you are here on a Sunday, so I imagine you also love to talk in depth about Chinese medicine, but my husband and children really don't want to hear about it any longer. So I treasure Brian and his dedication to the medicine as well. So let's jump into improving endometrial receptivity. So what is it? You know, I've been practicing and working with fertility for a number of years. And when I was first learned about receptivity, it was really as a secondary aspect, a reflection of ovarian quality, egg quality, that if the egg was in good shape, then naturally the endometrium would be in good shape too. And in, you know, our Chinese medicine lens is that it's this concept of the valley spirit, the fertile valley. If any of you have studied with Randine Lewis, you know that she teaches this concept that comes from the Tao Te Ching, and that the fertile valley is this yin concept. It's about receiving things coming to it. It doesn't strive or seek. Our patients for fertility, if they're coming in our door, not all of them, but I would say a good share of them are striving and seeking. We as providers, you're here on a Sunday to learn this material. Most likely you are also striving and seeking. And this, how do we bring the yin component to this through the process of preparing and learning more, and honestly through the process of having failure, right? Having patients that aren't receiving, aren't conceiving after everything is perfect. I've really learned that to take that analogy to the next step, that valley is fertile, but it's not just sitting there not doing anything. There is yang within that yin. There's life in that soil, right? There's nutrients there. There's I don't know, worms, all of it. There's a life component that's within it. It's not just still. So that's how I think of a receptivity from Chinese medicine. But you know, we work with our Western medicine colleagues. I'm never going to talk about the fertile valley with them, or not really, because that's not going to fly. What is receptivity in terms of Western medicine? It's this period of endometrial maturation during which the trophobecterm, that little outside part of the blastocyst, will attach to the endometrium and invade the stroma and the vasculature to get the nutrients, the blood flow. So it's really about the preparation before and involving implantation. It's more than the seed, it's the soil. Brian and I were just talking actually yesterday that we often will blame, in Chinese medicine and all fertility, we have blamed the egg for everything, and the embryo quality. And we use that concept of a seed and a soil. And we were talking and saying, like, no one's talking about the weather, like how the weather is affecting the soil. When we're planting a seed in our gardens, you know, in our backyards, or you're very rarely thinking, well, it's all the seed. Of course, the seed is important, but that aspect of the soil is just as important. And I want to read, so in this preparation, we did a lot of connecting with our Western medicine colleagues, and there's a reproductive endocrinologist that we work with quite a bit. And I was reaching out to her to get her perspective. I wanted to know what was going on in the clinic. as far as testing, which we'll cover later on. But she had sent this email, and I think it's a really great introduction to what we're going to be talking about here. This is what she said. My general comment about the advent of uterine testing. I always tell patients that two important conditions need to be met for an embryo transfer to be successful. You have to have the right embryo and the right uterine environment. In the days before genetic testing of embryos, if a transfer was not successful, our number one hypothesis for that failure was that there was something genetically off and that it was destined to never work. But as more and more people began to do genetic testing, this argument stopped being as valid, and a slew of tests have been introduced to evaluate that second component, the uterine environment. So what does it take to create a pregnancy? Quality embryos, just like this doctor had referred to, quality embryos and a receptive endometrium. And they're both really important, but they contribute equally. That's the question. Through the research, we were blown away by the information coming through that an abnormal endometrium is reported to implicate more than 50% of IVF failures. And there's increasing evidence that's showing that the priming of the endometrium, this process called decidualization, which you're going to hear about a lot, that they may contribute to more reproductive disorders than the quality of the seed of the egg. More than 50%, right? Not only that, the foundation of pregnancy is laid out in that endometrium just as much or even more than the quality of the egg. The failure to decidualize or prepare the endometrium, which is dependent on hormones, on different chemicals, on the immune function, in anticipation of that blastocyst coming, will infect the implantation and then the placenta, and it can lead to adverse pregnancy outcomes. In that time, I'm trying to decide how much do I share in each slide. During that implantation phase, they have to connect and talk to each other. There's a communication that happens between the embryo and the uterus, and that is vitally important to the outcome of a healthy pregnancy. So how do we know if there's a receptivity issue? I'm going to say oftentimes we don't. Clinically, when our patients are coming to us with a diagnosis of receptivity issues, it's been when everything else has been ruled out. This is after they've had a lot of failed cycles. They may have had recurrent miscarriages, unexplained infertility. Sometimes we know right away there's a uterine abnormality. But the point is that if you're working with fertility, you're definitely already treating this. And I want to start by sharing a case study. This is a patient that, we all have those patients that like get right into our hearts. This is one that got right into my heart. I worked with her for a number of years. She agreed to let me, this is her real name, but she said, please shout my name from the rooftops. I want everyone to know my experience. So this is the patient. She's 32 years old. She had infertility that was secondary to endometriosis, and she had thin type PCOS, right? So right away, this is a complicated patient. She was driven, a hard worker, a high achiever, very typical of the fertility patients that we get in our door. She had pretty good sleep. She had a pretty good digestion. She tended to feel anxious and stressed, but overall, she was pretty positive. She had experienced sexual trauma as a teen. She was under the care of a mental health therapist. Her periods were pretty heavy, really painful. She had large clots. The pulse was choppy and wiry in the guan position, deep in the chirp position, and her tongue was pale red, puffy, and had a little bit of a red tip. The diagnosis was blood stasis, liver qi stagnation, and underlying kidney yang deficiency. And I want to just do a side note here. I'm going to try to interject little clinical experiences that I think could be helpful that I've had or that my mentors have given to me. One issue when women have experienced sexual trauma, oftentimes you're going to see some blood stasis in that area. Think of the concept of the shen or the spirit is held in the blood. And when an experience is too much for the heart to handle, we have this beautiful ability, right? Think of the low vessels to shunt things away. So it's not uncommon to see this. I usually might ask in a way that's saying, have you experienced anything that you feel could be affecting your fertility? I open the door and I make sure to have a really good referral system to send these people to, because it's going to be a part of their healing overall. That's just a side note. So I worked with Nicole for many years. She ended up doing 4 IVF retrievals. She did 5 transfers. During that IVF, she would have difficulty building the lining. And we would use acupuncture more aggressively and diet, and then her lining would quickly bump up. She came in for acupuncture pretty much weekly until a stimulation, and then we increased that frequency to twice a week. If she had poor lining, we increased the frequency to 2 or 3 times a week. She did do herbs when she wasn't stimming for her IVFs. The doctor that I was working with preferred her not doing herbs during that time. And we were seeing progress. Her periods were less painful, less heavy. She was cycling regularly. The treatment strategy, I used acupuncture to clear heat in her heart through the pericardium. We relaxed the liver, opened the bowel vessel between the heart and the kidney. Herbs, a modified Gui Shao Di Huang Tang to nourish the liver bud and the kidney yin, included some herbs to support her spirit. And then during her period, we would modify Shao Fu Ju Yu Tong with a couple of blood breakers as well, because her blood stasis was pretty significant. And I didn't say her tongue, she had the sublingual veins too, so it was pretty significant. So during her journey, Nicole did conceive and gave birth to 3 children. She had 1 miscarriage as well. She lost her second son, her son, a few hours after he was born. He had trisomy 18. She learned that at, I think, the 18-week visit and decided to carry him to term. So these patients aren't going to be just receptivity patients or egg quality patients, right? They're going to be a mix of the two. And to point out, the patients that we're working with are very similar to this. It's complicated. So what does it take to have that successful implantation? Chinese medicine, it's pretty easy. We need healthy blood in the right spot. We need the free flow of qi. We need the heart-kidney connection to be open. And we need for the mystery of life to come through. Western medicine, it's much more simple. Blastocyst, good quality blast, a good endometrium, and the ability for them to synchronize and talk to one another. That synchronization, that's a process called crosstalk. Brian's going to talk about that a little further on. That's one of the things I think that I'm just so enamored with that concept. One thing I want to point out, what do we have a strength over our Western medicine colleagues, is this ability to work with the Bao Mai. Life is this coming together of heaven and earth, right? And what we're doing when we're doing herbs and acupuncture and all of the interventions that our colleagues on the Western side are doing, we're all really working on the earth side. As Chinese medicine providers, we can also open the door. While we can't force heaven in, we can't force life, we can help make sure that the pathway is open, and that's through that bowel vessel. Okay, let's talk about a little bit about what's required in terms of Western medicine. This is the cheap seats view, and then we're going to dive into the Chinese medicine. But I want to get us all on the same page. My guess is this is all going to be review for everyone here. So what do we need for a receptive endometrium? Shockingly, you guessed it, it's really reliant on estrogen and progesterone. And while these aren't solely responsible, they are definitely the building blocks. Estrogen is responsible for the proliferation of the lining during this pre-ovulatory phase, and it induces an increase in the progesterone receptors. After ovulation, the progesterone is what is needed and begins this major changes that are happening in the endometrium, the process called decidulization. Decidulization is also, we have a little bit here, there's an immunotolerance. Keep in mind that we have to have everything in, and then the mother has to be able to recognize this little being and not only allow it in, but like, I'm going to protect you as well. So the immune system is something we're really going to dive into.